Hi, my name is Carlene and I'll be performing an Heent assessment. I'll start off by gathering my equipment, providing privacy to my patient, and performing hand hygiene. I'll first start off by making a general appearance of my patient, just making sure that her clothing is neat and appropriate to the season. Looking at her hygiene, her mood, her affect, as well as her speech and hearing throughout the assessment. Taking note of her skin color, making sure it's evenly proportioned throughout her body. Starting off with the head and face, I'll make an observation of her eye contact and her level of consciousness, making sure she's oriented times 3. So if you could tell me your name and your birthday.
Teresa Anderson, January 7, 93.
Perfect. I asked your birthday. Time of year?
May
Okay.
2018, spring.
And place, where are you at?
Home. Office. Doctor's office.
Perfect. So she's oriented times 3. I'll next inspect and palpate the scalp, hair, and cranium, just looking for lumps or depressions. Perfect. Next, feeling for the temporal artery and the mandibular joint. So go ahead and open. Good. And close. Perfect. Next, we'll move on to the eyes. There's a couple eye exams that we can do. We'll start off with the confrontation test. So I will have you kind of scooch back. Perfect. And just have her follow my finger. Just making sure her pupils follow appropriately. Perfect. Next, the corneal light test. I'll take a step back and shine my light in her nose, just making sure that her pupils are symmetrical. And they are. Next exam is the 6 cardinal positions of gaze. So just taking a step back and having her follow my finger again. Perfect. Making a general observation of her eyes, making sure they're symmetrical. Also taking a look at the conjunctivae and the sclera, making sure that they're white and not yellow. Looking at her pupil size, making sure they're appropriate. I can also make sure that her eyes are reactive to light with my perla exam. Perfect. Next, going with the ears. I will inspect the external ears, making sure there's no lesions, drainage, or skin, making sure that they're both symmetrical. One's not higher than the other. Then going in with my otoscope, I'll pull back the pinna up and back. Perfect. Just taking a look at the tympanic membrane, making sure it's not swollen, red, there's no drainage, making sure it's intact as well. I can also perform a whisper test. So I'll come over here and whisper something, and you just let me know what I say.
Okay.
Oh no, you cover your ears.
Oh, okay.
I was gonna cover my mouth. Okay.
Baseball.
Apple.
Apple.
Perfect. Next is the nose. We'll make a general observation, making sure it's symmetrical to the face, making sure there's no drainage, redness, swelling. I'll look inside to look at the septum, the mucosa, and the turbinates. Making sure they're pink. Perfect. Mouth and throat. I'll have her say ah. Perfect. Making sure all of her teeth are intact. Her tongue is nice and moist and pink. Looking at the uvula, making sure it's symmetrical right in the center. Also looking to make sure any tonsils are swollen. Next, we'll move on to the neck. General observation, making sure that there's no masses, making sure that the jugular veins aren't distended, which they aren't. I can also palpate for lymph nodes, starting back behind the ears, making my way down the jaw. As well. I'll have my patient just kind of do a circle, look right, look left, look up, look down, making sure she has full range of motion of her neck. Perfect. And that concludes my Heent assessment.